As our body's pH changes, we compensate by increasing or decreasing our minute ventilation. Start exercising. Within minutes, you're breathing hard. Try taking 20 rapid and deep breaths. Stop and notice how slowly you breathe. Chemoreceptors in your brainstem, aorta, and carotid bodies are compensating to correct the pH. While respiratory compensation returns the pH to a normal range, the response is incomplete. Respiratory compensation will never bring the pH to a perfect 7.40. Both peripheral and central receptors drive respiratory compensation. As the pH drops, 80% of the response comes from central centers in the medulla. The carotid and aortic bodies play minor roles. What about the severe COPD patient who relies on hypoxic drive? The hypoxic drive comes primarily from the carotid bodies. As with carotid baroreceptors in the sinus, the carotid bodies are innervated by the Herring branch of the glossopharyngeal nerve. The brainstem does not respond to changes in oxygen tension. Carotid endarterectomies and regional techniques may significantly depress ventilation in patients who rely on hypoxic drive. Vertically, the medulla is located roughly between the nose and mouth. It is exquisitely sensitive to protons but not responsive to hypoxia. Carbon dioxide does not directly stimulate the medulla. Carbon dioxide diffuses across the blood-brain barrier and produces hydrogen ions. These hydrogen ions cause the medullary response. Stated another way, carbon dioxide works indirectly. Whereas carbon dioxide easily crosses the blood-brain barrier, metabolic acids such as lactic acid do not. Hence, the response to metabolic acidosis takes a bit longer than the response to carbon dioxide. With notable exceptions such as ketamine and Precedex, our medications blunt or nearly obliterate respiratory compensation. Carbon dioxide levels will rise after giving sedation for a procedure. Depending on the patient's pre-existing disease, regional techniques such as cervical plexus blocks may blunt the respiratory drive. A patient's specific comorbidities determine whether this is harmful or not. Assess the entire clinical picture and create a patient-specific plan.